there's not a perfect answer for that because it is very individualized to the person. What is going to tip me over may not tip you over. And so it's really, really important for the person to know their own body and know what the normal soreness is, know what you're sore today, but tomorrow is way worse. That should say something's wrong.
This is the Wildfire Lessons Podcast, where we promote learning by revealing the risk and complexity in the Wildland Fire Service. We share the lessons. The learning that follows is up to you.
Hello everyone, Christina Anabel here, Operations Manager for the Wildland Fire Lessons Learned Center. Today, I'm going to be speaking with Dr. Jennifer Symonds about rhabdomyolysis. At the Lessons Learned Center, we generally see a spike annually in rhabdo incident reports submitted in May, and 2026 has continued this trend. Dr. Jen also noticed this annual spike and recently spent some time doing a deep dive into all things rhabdo, from wildland fire cases to military cases and protocols and best clinical science. Rhabdo is a mysterious illness that is often thought of as affecting only people who move from couch potato mode to full send. But there are many factors that play into a person developing rhabdomyolysis, and it absolutely includes those who are very fit. During our conversation, Dr. Jen will unravel some of that mystery for us as she talks about what rhabdomyolysis is, risk factors for it, the symptoms we need to watch out for, and what treatment looks like. So with that, let's jump into the learning. Hello, and welcome to the Wildland Fire Lessons Learned Center podcast. I'm here today with Dr. Jennifer Symonds. We are thrilled to have Dr. Jen here to share her experience and knowledge. But before we dive in, Dr. Jen, would you mind telling us a bit about who you are and what you do?
Sure. I am the medical officer for fire and aviation management of the Forest Service. Besides being the program manager currently for the medical qualifications program for fire staff. And what I do is pretty much kind of anything that has medical related anything in it. I assisted with lots of stuff during COVID, and any medical questions that come up usually are directed towards me to figure out how to answer or to direct people. So that's kind of my job in a nutshell.
I'm curious because we don't really have many medical doctors in the Forest Service. So how did you even stumble upon this job? Like what were you doing before this? And you're like, oh, I want to work for the Forest Service.
You are correct. There are two medical doctors in the Forest Service. Dr. Michelle Curry, who is the National Medical Director for the EMS program for the Forest Service, and myself. And I was working urgent care in the Boise Valley for 15 plus years and was burnt out and at the end of my rope and watching for different positions that were open within the state when I found this job opening. And it was really heavy on IT as they were trying to create the e-medical system. And so I wasn't really going to apply, but my husband said, what's the worst they can do is tell you no. So I applied and surprisingly got the position. And as far as interest in the position, the reason why it appealed to me is that I watched multiple wildfires up on in the Idaho City area on a ranch of my husband's best friend. And my husband and his best friend had worked wildfire when they were younger as ADs when I knew them. And another of his best friends was a BLM wildland firefighter here in the valley. So I had exposure to the wildland firefighters and what they do, and watched the wildfires themselves and kind of understood some of the dynamics there, and thought this would be an interesting position to take. So that's how I got here.
Well, we're certainly very thankful to have you with the Forest Service. So We've asked Dr. Jen here today because at the Lessons Learned Center, we've been hearing about several rhabdomyolysis cases in firefighters and have generally just noticed a spike in cases annually, usually around May, that time when people are in critical training and doing a lot of PT, just kind of ramping things up and getting back into it. So Dr. Jen has also noticed that trend and recently conducted a deep dive into recent and historical incident reports. We felt it was really worthwhile to highlight some specific risks to our workforce and the lessons around prevention, response, and treatment of rhabdo. So let's start with some of the basics. Dr. Jen, what is rhabdomyolysis?
So there are a couple types of rhabdomyolysis. We are specifically in this setting going to be talking about exertional rhabdo. And that is basically a case of rhabdo that surrounds some type of an exertion event. So whether it's significant exercise, whether it is the exertion spent in an emergency response, but it has some type of exertion related quality to it. And rhabdo is injury to the muscle that basically damages the cells, and the cells then leak out their cell contents, which then become toxic to the body. So whether it's the myoglobin that comes out of the cell that is toxic to the kidney, whether it's potassium or calcium, and those are toxic to the heart and other organs of the body. The symptoms of rhabdo are muscle pain out of proportion to what you would expect. So if you're talking about exercise, it's, you did that workout and you expect in the next day to 2 days, maybe 3 days, you're going to feel the soreness from that workout that you did. But if in the next day or 2 days, you start with the soreness, but it just exponentially rises, you start out 2, 3 and you go to 4 and you go to 6 and now it's at an 8. That's something that you're not expecting. It's out of proportion. So that's one of the symptoms that could occur. It does not occur in everybody. Another one is swelling of the muscles, as well as weakness of the muscles. We did have one FLA where an individual had swelling of the biceps and was unable to move the arms well. Muscle spasms is another one. One of the other FLAs there, if I remember correctly, was arms as well. They just weren't able to straighten their arms at all. They were spasmed. Urine, dark urine. So it's not dark yellow urine. It is tea-colored, reddish. It's brownish, reddish, cola-colored urine type of thing. And that's an indication that you likely have rhabdo. Not that it always is, but it's possible.
Thanks for that. And I kind of keyed in on the part where you said, when you're a little more sore than you normally are. And I was just talking to somebody just yesterday who's had rhabdo, and they were reflecting on what it was like for them to go through that experience. And they were talking about how it was 3 or 4 days into critical training, and they were getting ready to do another round of PT, and they turned to their crewmate and they're like, man, my arms are sore today. I kind of have a hard time straightening them. And the crewmate was like, why are you telling me this? Did you not work out this year? How are you this sore? And after they ended up getting rhabdo, the two of them were having a conversation and reflecting on that. And they're like, oh, that was an unusual comment. Maybe we should have keyed in on it a few more days prior to actually going to the hospital. And it was that I'm actually more sore than I've ever been, but not really taking note of it.
Yeah. And a lot of time it's that individual, they don't want to be that one, that crew member who complains type of thing. That's been stated in several of the FLAs for our rhabdo cases.
That's definitely an influence. I know going through critical training every year, you don't want to be that one. You don't want to be the one that did not work hard enough in the off season. So I can see how that would influence people, yeah. But definitely something to notice. Are you more sore than you normally are? Is this an abnormal level of soreness for your fitness level? So with that, we have a lot of people who are really in shape. They train all winter long. They're getting ready for the season. Why do firefighters get it?
So I can only speak to wildland firefighters. There are other reasons for structural. But as far as our employees getting it, there are several different risk factors, and there's no one specific, this is the cause of rhabdo in everybody. It's a combination of factors of the different risks that are out there. And so when you talk about risks, the military has got a lot of studies and documentation and whatever you could think of on rhabdo, and they are kind of the gurus and have put out the clinical practice guidelines in regards to responding and treating rhabdo. And they talk about the 5 T's. And the first 2 are too much and too fast. So your high volume, high intensity, or unaccustomed exercise. So, the individual who on the off season or are newly hired, they knew they had to do something, so they did a lot of the hiking and biking and running and more lower extremity type of stuff, but didn't do so much in the upper extremity. But then when they come on, maybe they are expected to do more push-ups and pull-ups and use those upper extremities more than they had basically trained for. And so that's the too much, too fast, or the unaccustomed exercise. The third is too soon. So they don't give enough recovery time in between exercising that portion of the body. So, typically a lot of times you do upper body and then the next day you do lower body, so that you give the upper body a day to rest type of thing. And so if you're doing upper body, or lower body, lower body, and you're not giving that recovery time. So too soon is the third one. The fourth is timed test. And this encompasses a couple things. One is that high intrinsic motivation. You don't want to be that one. So it's not necessarily a time test, but you're going to push through because you want to keep up with the rest of the crew. You don't want to be that one. Another one's competition. I don't know that I've read any FLAs where it was a competition issue, but we know those individuals who compete against each other on how much somebody can do. So competition is another one. And then a timed test that you're not trained for. So you didn't do the training to get through the timed test. So we've got those individuals that in the past, and more things that I'm remembering are more FLAs on compartment syndrome, but doesn't mean that there's not a component of rhabdo to it. But the individuals who really don't do a lot of training for their work capacity test, I might jog once or twice a week type of thing, and that's all they do. And then they go and expect to pass that work capacity test, and then they end up with a case of compartment syndrome or rhabdo. So that time test, there's a reason why we tell people to train for that test. Granted, it's typically not a hard test for most people who have trained for it, but we do have those individuals that struggle with it. Fifth one is a tyrannical trainer. So we can all visualize that. Military-wise, it's the ones who use exercise as disciplines, drop and give me 50 type of thing, and they tell that same individual to do that multiple times throughout the day. But it's also somebody who pushes an individual beyond their capability or stacked exercise days type of thing. So those are risk factors. It's not that all of those are a definite. If you do all of these, you're going to get rhabdo. Other risk factors are some things that people don't always think about, but they might have heard murmurs through the grapevine about it. So medications. There's several medications that are a known increased risk, but low to contract rhabdo from. Your cholesterol medications, some of the mental health medications. But again, it's low. It's not a definite. If you take this medication, you're going to get rhabdo. But there are also a lot of other medications that have a really low risk. So when you look at side effects of medications, a lot of those side effects that are listed are the fact that when you report a side effect to a medication, people are told to report anything. So when they did the study on the medication, if someone got the flu while on the medication, that's reported as a side effect. Well, this medication is not going to give you the flu, the flu is caused by a virus. You contracted the virus, but it's listed in that side effect profile. So there are lots of medications out there that they might have had a case of Rhabdo, and so it's listed as low probability of Rhabdo in the side effects that the monographs that the physicians get. So that's a possible risk factor. Supplements. We hear a lot about supplements, whether it's energy drinks, whether it's protein, creatine, whatever it is out there that people are taking. And so there is nothing in the literature that can state that supplements are a cause of Rhabdo. Is it suspected? Yes, a lot of individuals suspect that there's some type of relationship. They are reported very frequently in case reports of exertional Rhabdo, but there is nothing to say one caused the other. My question or my guess is, especially the energy drinks, it's not just caffeine that's in the energy drink. There's herbal supplements and other things. And so is it a question of, is it the caffeine? Is it the combination of the caffeine and the herb? Or is it just the herb that's causing it? We all know those people who practically mainline coffee. So they get probably just the same amount of caffeine in a day that somebody drinking the energy drink is getting. So I don't know necessarily that it's the caffeine that's the cause, but I question the combination of things. Dehydration basically helps damage the cells, and so it can increase the risk of damage to the muscle cells, but it also decreases the ability for your kidneys to clear those cell breakdown products. So when we talk about muscle injury or cell injury with exertion, anytime you exercise, it's the normal wear and tear, and you've got breakdown of muscle and some of those products going into the bloodstream. It's just not an extreme. Rhabdo is that extreme. So your kidney needs to be able to clear those cell products out. Medical conditions is another risk factor, along with illness and your genetics. So infections can increase your risk for Rhabdo. Some of the common medical conditions: uncontrolled diabetes, uncontrolled thyroid disorders, hyperthyroid, hypothyroid, kidney diseases that are not controlled, and then muscle diseases that's more on the genetic side, because then you've already got a problem with the muscles to begin with, and this is just another thing on top of it. Substance use disorder. Chronic alcohol use is toxic to muscle cells, and that's not saying abuse, it's just chronic use. So it is toxic to your muscle cells and then increases your risk. Some street drugs elevate the body temperature. So that body temperature piece, when you've got an elevated body temperature, then you're more at risk for damaging the muscle cells. So those are the most common risk factors. There are many, many others, but those are the most common.
That's a lot. And it sounds like pretty much anybody can come down with Rhabdo. Like, I think sometimes there's this misconception that only people who are not fit will get Rhabdo, or the going from the couch to 50 miles an hour, like that's when you get it. But thinking back to the 5 T's that you mentioned, the too much, too soon, time test, competition, and tyrannical training, like, to me, that really personifies our 2 weeks of critical training. A lot of crews are doing 2-a-days.
Yes.
A lot of people are, pushing harder than they are when they're just working out by themselves. And I wonder if that helps to explain why we see this spike in May almost annually with Rhabdo cases.
More than likely, yes.
I also heard you mention compartment syndrome, and I know that's popped up in a few RLSs. Can you explain that relationship a little bit more? Is there a relationship between the two?
There is. So compartment syndrome and Rhabdo are 2 different diagnoses, but they can be associated with each other. So you can get compartment syndrome, which is an increased pressure within a compartment of the body. And so your muscles are divided into compartments surrounded by a kind of non-giving connective tissue. And so it only spans so far. So it's not like the balloon that's stretchy and it stretches. It's more like at the end of that blowing up of the balloon, it'll stretch so much more and then it's going to burst type of thing. Well, this doesn't have the ability to burst, and so the pressure just continues to build within that compartment. And besides muscles that are in that compartment, you've got blood vessels and nerves. And when that pressure builds to enough extent, the blood flow is cut off to those muscles. And so you lose nutrients and oxygen to those muscles, and things start to die after a certain point. So when they die, then again, those cells burst open, they release their cell products, and now you've got a rhabdo case on top of compartment syndrome. Now, if you have rhabdo first, and they're leaking out things from the muscle, if you've got so much of an injury to that muscle that it's not able to be absorbed by the bloodstream as quick as it's being released, then it'll be released into that compartment. And it'll build up to a point where you've got the pressure, and then it can cause compartment syndrome. So one can cause the other, but they are not the same thing.
Thank you for that clarification. I think another thing that we hear sometimes, and I think this stems from like the first few times that Rhabdo was recorded and reported to the Lessons Learned Center, they were during incidents where it was hot. The temperatures were really high, the humidities were really low, and at least in my recollection, when I first started hearing about Rhabdo, I thought it was a heat-related illness, but it sounds like heat might only be a small factor in that. So what is the relationship there, and is Rhabdo classified as a heat-related illness?
No, it is not a heat-related illness, although heat can increase your risk for it. So elevated body temperature, whether it's because of environmental/weather factors or whether it is because of medical condition or infection, it basically makes the cells easier to damage or injure. And so if you've got that point of hitting a certain temperature, which is unique to each individual. It's not a fact that you hit 104 and everybody's going to get it. It's all dependent on the individual. But it'll make those cells easier to injure. So when you're talking about the extremes of heat exhaustion or heat stroke, you're talking about higher temperatures. And so if you think about it, the reason why you've got heat stroke is because you're not able to cool off. Then your body temperature is continuing to rise and rise and rise. And you're basically cooking yourself. So if you're cooking your brain, which is why you pass out or you're not mentally intact because of this heat stroke, you're also cooking your muscles. And so you're damaging the cells and they're releasing their products.
All right. So it sounds like definitely a factor, and we should be on the lookout when we're starting to see heat-related illness symptoms. But it also sounds like folks can get it when it's cold and wet and rainy, that it's more based on that exertional part of that exertional component than necessarily temperature.
It's a matter of the right factors lining up for the individual. It's not that if you have this, this, and this, it doesn't matter who's on your crew, they're all going to have it. It's you've got this, this, and this, and it's in this person, they're going to have it type of thing.
Yeah, that's interesting. I know a couple of people who've had Rhabdo, and I think it's always been kind of like messes with the mind. Like, why me? Why didn't anybody else? We were all doing the same thing. I'm fit. What was different this time? And I think that can be hard with so many, all the things that you listed off earlier with all the different factors. It seems pretty complicated and maybe not entirely easy to tell just why somebody may get Rhabdo when they do. So with that, what are the current best practices for prevention?
It's stuff that, we preach all the time. So healthy diet, hydration, PT year round, not PT a month before you come on. And then as soon as you're laid off, no more PT. PT year round, keep your fitness up. and PT the way you did during the season, so that you keep all of those pieces at the same level. Ensure your medical diagnoses are static and stable. So you're seeing your provider as you're instructed, you're taking your medication as instructed, all those pieces. And then listen to your body. Your body is telling you something is wrong. Listen to it.
Listen to it. So that muscle soreness, the tea-colored urine. I know one of those cases, the person was extremely hydrated. Their urine was actually almost clear, and it just had the faintest tint of brown to it. Anything else they should be looking out for besides that muscle soreness and tea-colored urine?
It's just really those specific symptoms: the muscle pain, the muscle weakness, the urine, spasm muscles. And it's all that, not what you're expecting. It's one thing to have worked out, have the soreness, get a spasm here and there, but this is like muscle spasms, like, how to describe it? Kind of like seizure muscle spasm type of thing. It's not letting go. It's not easing up as you would expect.
Right. Like, where's the tipping point between normal soreness and now my body hasn't had enough time to require after 3 days of 2-a-days, and now this soreness is different?
Yeah, there's not a perfect answer for that, because it is very individualized to the person. What is going to tip me over may not tip you over. And so it's really, really important for the person to know their own body and know what the normal soreness is, know what if you're sore today, but tomorrow is way worse. That should say something's wrong. It should be just kind of constant type of thing. So it's really being vigilant for your symptoms and knowing your body, knowing your norm, basically. But the other piece that's really important, and I know, years ago when we were really focusing on this, it was part of the your critical training, the videos that you watch. But I don't know that everyone's talking about it every year in their critical training now. But the education, reviewing what Rhabdo is, what are the symptoms, should you be watching for, basically. The other piece, though, are leaders making sure that their crew members understand they are approachable. They want to know if something is wrong, because this is not something that is a benign thing. Yes, a good number of our cases are benign. They don't have any bad outcomes, but it could lead to kidney failure. It could lead to a kidney transplant. It's less likely in this case to lead to death. Rhabdo from a crush injury, that is more likely to lead to death, just because of different factors and the extent. But Rhabdo itself is just not I've got a cold, it'll go away type of thing. It can be a bad outcome if you don't catch it soon. So making sure that your employees understand you want to know if something is not right, or tell your EMS on your crew or whatever, but they need to know that it's okay to say something's not right here. I'm just way sore than normal or whatever, so that you can be checked out.
That's great advice. One thing that we've seen, I think in one particular RLS, I believe it was out of Oklahoma, they found during their experience that they had gone to the hospital, said I'm a wildland firefighter, think I have Rhabdo, and they were kind of met with, well, we're not really sure, we're going to run some other tests first. And so what came out of that RLS, they had put together just a little job aid that folks who were experiencing symptoms could bring with them to the ER, and they could hand it to the medical professional and say, here's some information, I'm a wildland firefighter, we're starting to see more cases in our field, can you please test me? So what do folks need to tell medical professionals when we take somebody in with these symptoms?
that can be a two-edged sword. So a lot of times, depending how busy the ER is, they don't want to hear about it. And other times they are open to hearing about it. So, back in, I think it was 2016 when we first really started having a bunch of cases, I put together a flyer that I know a lot of the crews back then carried with them. The soups of the shot crews would have it on their clipboards and have it so that if they had to take someone to the ER, they handed that flyer to them that basically talks about who our employees are, what these individuals do, what the symptoms are, because at the time there were still a lot of ER docs that didn't know what exertional rhabdo was. It's just becoming more and more mainstream talked about, and I don't know whether it's increased cases in athletes that are causing it, the more cognizance of what is going on, but so they're a little more aware of what's going on, but a lot of them probably have not seen a case, and so they're like, okay, now I've got to look up what's the numbers that I'm looking for, or how should I deal with this? And so that flyer tells them what the lab value is that you're looking for, as far as they've definitely got rhabdo or not, and if they don't have that number, it's lower, but there's a high suspicion because of the symptoms, then it recommends that they put them in for observation into the hospital and then do serial blood tests to check and see if that value is rising. And so that flyer was attached to several FLAs in the past as well. So it's out there. I did just update it because the military just updated their guidelines as to the lab value that is used. So that is going to be updated and on our work capacity test website. So yeah, it'll be out there.
That's great. I'm glad somebody's out there monitoring that. It's great to have somebody staying up to date on the best available science and changes like that. So you'll have to share that with us so we can update that on our website as well.
I can do that.
So what are some of the key items for firefighters to know? We've covered some of the prevention stuff, how to, the symptoms, but like what can they expect for treatment?
As far as treatment, so the basic treatment for rhabdo is IV fluids. They basically want to flood your body with IV fluids so that they can clear the kidneys out and clear out the toxins that are in the blood. And the kidneys are what clean the blood to get the toxins out. So you want to make sure that the kidneys are clearing out stuff. It's a rare case that if the kidneys are not able to do the job for whatever reason, and they're starting to become injured, which is found on blood work, so you'll have routine blood work going on, you may have to go for dialysis. And it's not that you will definitely, once you start dialysis, you will be on dialysis forever or have to have your kidney transplanted. But dialysis will be used once they start seeing injury to the kidneys and that they're not functioning as well. So that's a possibility. But the vast majority of our cases are strictly IV fluids, get the numbers down, and then you're discharged. So hydration, I can't say hydration enough. Hydration.
With the hydration, are we talking just water, or are we talking electrolytes, a combination of both?
So during fire, and you're out on fire and you're sweating up a storm, a third to a half of your fluids should be electrolyte solution, and then the rest should be water. If it's off season and you're not doing all of that work where you're getting so sweaty, it's just a matter of making sure that you are eating a healthy diet. You salt your food. You get all of your electrolytes through your foods, basically, as long as you're eating a healthy diet and not crap that's out there. So, so off season, you don't necessarily need to worry about the electrolyte piece, depending on what you're doing. But when you're out and you are on assignments, then at that point you want to follow the NTDP replacement for fluids.
We talked a little bit earlier, you mentioned that leaders need to be approachable and they need to encourage folks to speak up when they know something is wrong. Do you have any other advice for supervisors to help prevent rhabdo or reduce the probability within their own crew or module?
Everyone is so different. Crew leads have tried altering things so that hopefully they don't have another case. So I know there's a lot of stuff out there that's been tried. I don't know that there's perfect answer for that. It's really, really getting to know your crew members, paying attention to what you're seeing. We all know, like you said, you don't want to be that crew member. So you might not want to speak up about things. But if you notice they're normally right-handed and now they're carrying something in their left that they normally would have carried in their right hand because maybe that right hand or that right arm hurts type of thing. It might be picking up on those little subtleties and saying, hey, what's up? How's your right arm? Everything okay? It might just be that one question of asking if something is wrong, that then that employee might be willing to state, yeah, I'm having a problem type of thing.
I'm going to ask a potentially controversial question. Some things we hear during critical training is we have crew leads or whoever's running the PT program. A lot of them rely, I wouldn't say a lot, but some rely on CrossFit workouts of the day, high rocks, some other like very high intensity workouts that maybe might not be part of somebody's normal off-season PT training. Do you have advice for the folks who are leading PTs on just like what's appropriate and how can we create workouts so we give people time to recover in between? Maybe we're not doing too much, but we're still doing the high intensity stuff that we need to do to be ready for the season.
I'm not the expert on this. I do know that there has been lots of discussion within the past 7 years, 8 years about PT and is there a way to give some type of guidelines or guidance in regards to how to go about doing PT and instructing for PT. I don't have a perfect answer on that. I do know a lot of the case reports out there that are in medical literature. Many are associated with CrossFit. There are some that are associated with high intensity interval training, the HIIT stuff. But those ones tend to be more people who just really go beyond what they should be doing. Is CrossFit a definite cause? Can't say that. Again, it's all those different factors layering upon each other. I don't have a perfect answer for that one. I would say if you've got questions in regards to PT and is there something you should be tweaking or changing, I would probably look more towards NTDP and Joe Saul's group. And I don't know that I've seen anything out from them specifically about it, but I don't keep up on that piece very well. So, but that's where I would direct an individual if they came to me.
Appreciate that. I know it's a bit of a controversial question. I have just, from the folks who are in the CrossFit community, I've heard them reference, oh, Uncle Rhabdo came to visit on more than one occasion. And I've heard people kind of talk about that a little bit. So I thought I would just throw that question into the room, but it sounds like we don't have any causal information. We've been seeing at the LLC, I think we saw our first report of exertional rhabdomyolysis around 2010, but we didn't really see much about it before then. So did it not exist before in Wildland Firefighters? Was it being misdiagnosed, or has something changed in how we're doing things?
It's likely not something new. It's likely something that just wasn't diagnosed, and likely not something that was at an extreme. So if we talk about how significantly weather and in the environment is changing over the last 20, 30 years, it's definitely hotter. It's drier. It's, in certain areas drier, but it's hotter. And so 20, 30 years ago, we didn't have all those 100-degree temperature days here in Idaho in the Northwest like we're having now. So is it likely that we had cases back then? Yes. It's likely that they weren't as extreme, so they weren't picked up. Whereas now we've got all these different factors that are playing into it, whether it's the weather and the heat, whether it is more people on medications, whether it is, not that this is always the cause, but our low activity individuals coming into fire. All those different factors that I talked about. Do we now have more of that perfect storm that is occurring, that now we're seeing more extreme cases where we've got more severe symptoms and they're ending up in the ER because of it? Whereas 20, 30 years ago, yeah, they had soreness, it got worse the next day, they just kind of toughed it out, and eventually it went away, type of thing. It doesn't mean that they didn't have rhabdo, it's just that it was never diagnosed. So I don't know that, I doubt it's new. It's just we are diagnosing it more, and I think we've got probably more on the extreme side of symptoms, and so it's being seen.
Okay. We've focused a lot so far on this podcast on exertional rhabdo during PT and critical training, just because we do see that spike every year in May, but it is also happening on fire assignments. Do you have any different advice, but besides the stay hydrated and know your body? Are there things we can be doing differently on the fire line that can also help prevent? Like, do we need to take more breaks? Do we need to move our hours of working around?
There are things that could be done differently. It's a matter of changing thought processes. So kind of like there has been those, kind of slowing down and pauses, in the late afternoon because of all of our fatalities that have occurred in that time frame, type of thing. Stopping, taking a situational awareness minute, type of thing. What's going on, type of thing. Could go in the same aspect with this. When it's hotter, should we be taking more breaks so that we let the body cool down and give our muscles a little bit of a rest, type of thing? It may not be that instead of taking, and I have no real knowledge on this, but instead of taking the 15, 20, 30 minute breaks every, once an hour, 2 hours, however you're doing it, maybe working 30 minutes, taking a 10-minute break, working 30 minutes, taking a 10-minute break, type of thing, so that you're kind of slowing down, letting that body kind of cool off a little bit, give off some of the heat, and give the muscles just a short break so that they can kind of start to recover. So there's definitely things that could be incorporated. It takes a change in thought on what's going on and paying attention to all of the different pieces that are occurring.
Well, it sounds like we've covered everything, and our key takeaways are stay hydrated, know your body, speak up when something isn't right. Thank you so much for being here today. This is a really important topic. I'm a huge advocate of talking about this and getting the information out there. So really thank you for coming on today, Dr. Jen. We really appreciate your time.
Thank you for having me.
Thank you all for listening to episode 46 of the Wildland Fire Lessons Learned Center podcast. We want to extend a huge thanks to Dr. Jen for coming on the show to help educate our community on the symptoms and risk factors of rhabdo. We covered a lot of things with Dr. Jen today, and you can find all the mentioned reports and references in this episode's show notes. As we sign off this episode, we hope that you take some of the things Dr. Jen discussed forward. Stay hydrated, take breaks, listen to what your body is telling you. Take a few extra seconds to ponder your coworkers' potentially out-of-character comments about their level of soreness. As a supervisor, is your PT plan or pace of work allowing time for your employees to recover? That concludes our learning for this episode. As always, we hope we gave you a few items to think about and discuss with one another. Take care.
Thank you for listening to the Wildfire Lessons podcast. Don't forget to head on over to lessons.wildfire.gov to get all the latest information from the Wildland Fire Lessons Learned Center. You can subscribe to our email list and follow us on social media. Music is provided by second-generation smoke jumper Steve Baker, who always likes to keep one foot in the black. Thanks, Steve. Remember, we honor through learning.